Hello, my name is Christina, and I am part of the Health Needs Spotlight team. We are a new organization with a mission to empower people to make their own healthcare decisions. We create video content, information guides, and on essential topics like chronic disease, mental health, health literacy, respiratory illnesses, and more to help people optimize their health. Today, I'm joined with Jason Faghih, who is an upcoming graduate this April in general dentistry. He wants to pursue cosmetic dentistry and become an oral surgeon. We will be discussing more about periodontitis. Thank you for joining us today. How did you know you wanted to become a dentist?
So I've always wanted to be a doctor ever since I was in my undergraduate. I did my undergraduate at the University of Washington. And, dentistry is a very unique field, very unique discipline. And there's a lot of things that are very beautiful about it. Among them being you have, obviously the privilege of, being a doctor and being able to help those that are in need, especially in their healthcare and taking that leadership role in practice. But also you can have so many different opportunities in the field of dentistry to work either in a clinical setting or B in a hospital setting doing more complex advanced procedures. And then there's a lot of networking opportunities working with other healthcare providers, physicians, nurses. I mean, it is a very, holistic discipline. And so I, recommend everybody give it a chance. Everybody I would encourage to shadow a dentist, shadow any healthcare worker, because it's a very unique discipline. And dentistry in itself is an art intertwined with a medical approach. And if you think about it, the oral cavity is kind of a vantage point for general well-being. And to me, why I specifically chose dentistry over other healthcare disciplines, such as nursing, such as going the MD route. To me, dentistry, if you think about it, you look at somebody smiling, you smile, I smile. It's humanity in essence, and it's in its purest form. And that's what I want to be able to give to my patients is the confidence and the ability to smile, and to feel good about themselves and to make their life better, the quality of life that much better. So that's why I chose dentistry.
What is periodontitis and how could one be diagnosed with these diseases?
Periodontitis basically is a chronic disease that can be managed. However, it's what happens after what's called gingivitis. And it's an exacerbation of it. And what it involves is an inflammatory response. So itis is inflammation. And the periodontium consists of basically the soft tissue and bone around the tooth. And so when you have periodontal disease, you have bone resorption in addition to clinical attachment loss. And this is all as a result and a consequence of the inflammation due to plaque inability to control. So, for example, if someone has poor oral hygiene or even genetic predispositions, they can have a higher chance of developing periodontitis. And so this is just something that is a chronic thing unless it's dealt with and treated. And so, people who neglect their oral hygiene continue this, they'll start to notice that they'll have what's called halitosis, which is poor odor breath. They'll start to feel like their gums bleed. And this will eventually lead to tooth loss due to the bone deterioration.
Are there any treatment for this disease?
Yes. So if it's caught early, there are a lot of treatments that can help to stabilize it so that it does not lead up to further exacerbation and potential tooth loss. And so things that are offered in terms of treatment in the beginning are what's called deep cleanings. And it's another word is scaling, and root planing. And basically what that consists of is dependent on the level of periodontitis. So there are different stages of periodontitis, and depending on that, what the practitioner or even the hygienist will do is they will numb you up. And if you have to do multiple quadrants, then they'll numb you up, and they will basically use what's called a cavitron. It's an instrument that vibrates and it releases water, and it helps to remove the calculus that is subgingival, that is causing irritation to the gingiva, and then inflammation that's causing the resorption of the bone and leading to deep pockets. And that's what periodontitis is. And so this is used in periodontal treatment, especially in the case of periodontitis, where you have deeper pockets that cannot be cleaned with, for example, using your traditional water picks or a toothbrush. Is just too deep to get to. So they use a cavitron, and that's one way to treat it. And then another way, and they also use this along with using a cavitron, is hand scalers. So hand scalers are instruments that are used, and they have sharp ends or sharp blades, and they just go around the tooth that the provider is working on, and it basically helps to scrape away the excess calculus that's causing this issue to begin with. So those are the two biggest things that I would say is the preliminary treatment. But then there are also, if, for example, these treatments do not work significantly well for the patient and there's more to be done, then what could happen is at their 1 month peri reevaluation following SRP treatment, scaling root planing, they will check the attachment loss again, and they will see if the pockets have decreased or not. And in that way, they can figure out what is a prognosis of continuing to try and attempt doing SRPs, or to change that treatment plan and possibly refer out to a specialist, like a periodontal specialist. And in dentistry, this is called a periodontist. It's a perio specialist. And so what they can do differently is they have other treatment modalities, such as surgery, to fix this problem. This includes connective tissue grafting. This includes free gingival grafting, depending on the indication of what they're trying to fix. They can also do new techniques called pinhole technique. I would encourage everyone that's watching to look up these techniques. And these are just ways to help with, recession or attachment loss or deep pockets. These are just more invasive ways of treatment, in addition to scaling and root planing, which is kind of the initial treatment to try.
What is the difference between periodontitis and gingivitis?
So gingivitis is basically right before the succeeding periodontitis. And gingivitis is reversible. So that's what's nice about gingivitis, is that, although it is uncomfortable, it is an inflammation of the gingiva. It is one of those things where gingivitis can cause pseudo pocketing, okay, which is different than periodontitis, which is actual pocketing due to attachment loss. So think about what happens when you have an inflammatory response and swelling, right? The tissue starts to become erythematous, it starts to get larger, and it becomes a lot more swollen, and it puffs up. When that happens, you get what's called a pseudo pocket. And basically what that means is it's not a real pocket, because it just means that the gingiva is actually just rising. Okay. But it doesn't mean that at this point you have bone loss, and then now you also have actual pocketing. And so what gingivitis exactly is basically, like I was saying, it's what happens before the potential periodontitis, where you have a lot of plaque accumulation, You could also have some calculus accumulation, but you still don't have bone loss. And so with gingivitis, treatment includes, for example, a regular cleaning, an adult prophy or a child prophy. And this can help to resolve the problem temporarily, but one must continue their oral hygiene regimen at home to make sure that this does not lead to periodontitis.
Are there any common age ranges where these diseases are seen?
Common age range, you know, it depends. Gingivitis happens more at a younger age. It can happen at any age, but I see it a lot of times in the younger age group. It can also happen with women who are pregnant due to hormone imbalances. Um, and so, also autoimmune diseases can cause things like this. There's a lot of correlation to it. But with periodontal disease, I can't give you an exact range. I've seen patients who are, very young, even in their mid 20s. And then I've seen patients that are much older that have periodontal disease. It's just a matter of time and neglect, and that's what really exacerbates this condition. And that's what I say is, when you start to notice gums bleeding, poor breath, you notice that things don't feel right, I would highly encourage going to see your dentist to see what's going on, so that they can help to treat, so that things don't get worse. I see a lot of patients who are, diabetic, or they have other systemic diseases, and they neglect their oral cavity. And later on, they notice that things are not doing well. They have tooth loss, they have pain, they have bleeding, and they come, and it's at this point, there are treatment modalities that may not be the most attractive options for them, because they neglected for so long, and now there's very little to work with, right? So I would highly encourage anybody that has these types of symptoms to go see their provider as soon as possible.
Can the type of food we consume worsen one's condition?
So diet does definitely have an influence. Foods that have the capacity to create an inflammatory response. I would encourage those who eat kind of everything to maybe manage that, and eat at separated times of the day, so that their mouth has time to stabilize in terms of pH, because that also coincides with potential for having cavities, right? Cavities are dependent on having a vulnerable tooth surface, the time, and diet, right? And so this also can correlate with periodontal disease, because those who neglect, you know, taking care of their teeth will also neglect taking care of the tissue surrounding their teeth. And so diet plays a role, because those who eat at throughout, or let's just say throughout the day, okay, and don't give time between those meals, can have the lack of pH balance to help to control the the pH, so that their teeth can remineralize, or their periodontal compromise can resolve. So I would encourage that that meals are at different times of the day, and that you space them out, because consistent snacking, regardless of what it is, carbs throughout the day intake, can lead to this lack of pH balance. And it's just because of the time.
Can consuming alcohol or smoking worsen one's condition?
Absolutely. Yeah. So, and this also includes things such as e-cigs, or vaping, anything that has nicotine. So, putting tobacco to the side, tobacco, I would highly recommend that people avoid using things like this, because yes, it can definitely exacerbate the condition. But even things such as vaping, because it has nicotine in it, nicotine is a vasoconstrictor. So now you have limited blood supply to this area to help treat a specific condition. Your blood has platelets, it has cells that help to rebuild. And when you are depriving those specific areas in need for immunity, for growth, you are inhibiting the healing response. And so people that do smoke or use vaping or things like this, they will notice that their gingiva may not bleed as much because of the vasoconstrictive effects of nicotine. But that doesn't mean that their periodontal disease isn't going to continue to exacerbate due to bone loss and the lack of support for the tooth itself, because of these habits. And alcohol similarly can exacerbate these conditions too. There's a correlation between these things.
Can gum disease affect other organs in the body or lead to any other internal diseases?
Yes. There's correlation with liver disease, there's correlation with kidney disease, cardiovascular disease, and it just depends on, the ability for these bacteria to end up becoming systemic into the bloodstream, right? So you have vessels, you have capillary beds, and bacteria are kind of going in and out. I mean, you think of it as just a localized area, but like I was saying before, the oral cavity is a vantage point for everything in the body. It's a vantage for general well-being. I mean, anything that goes into the oral cavity and manages to get into the bloodstream can affect other organs in the body.
Can periodontitis be seen in animals like cats and dogs?
Absolutely. Yes, it can be. And it has similar manifestation, as it would in humans. Yeah. And the treatment, I mean, dogs, if they were to have a deep cleaning done or cleaning, they also use similar instrumentation. They use a cavitron, they use scalers, things like that. So yes, in animals, it's also seen.
With financial stability being a common issue today, what can those who cannot afford dental cleaning do to prevent these gum diseases?
Being self-aware, being self-aware of changes in their oral cavity. But I would recommend that brushing is a consistency. Brush at least twice a day. Brush in the morning, brush at night. And I would also encourage that, if you do brush, um, you know, watch some videos on proper brushing technique. You want to get those bristles up into the sulcus of the tooth. So basically around the gingiva and into it, so that you can get into these areas where you have potential pockets to clean them. And so even though some may have deeper pockets and it's very difficult to get to, try your best to manage before it gets to that level, right? And when it does, know when things are going wrong. And and to know that, you have to go and see your provider. It's one of those things where it's not something that you can just manage at home without having seen your provider to know the severity of it. You might have stage 4 or stage 3 periodontal disease and you're just continuing to brush, and that's not getting to the very deep pockets that are potentially causing exacerbation of bone loss, and now your teeth are going away, and you're thinking to yourself, like, I'm brushing and I'm flossing, I'm doing everything that I can, but I'm still having tooth loss, right? So it's one of those things, is do your best to brush at least twice a day. Floss, because flossing will get to the plaque in between your teeth, right? And if you think about it, the plaque that accumulates in between your teeth can manage to get into the what's called the embrasure space, and then that can eventually lead into creating these pockets, interproximally in between your teeth, meaning. And so I would recommend that people who have a lot of spacing between their teeth, or they have even braces, to continue to try and floss. And even if they have spacing, I would still try to move the floss around the tooth and even into the socket, so that they can, or not into the socket, sorry, but into the sulcus of the tooth, meaning where the gingiva meets the tooth. And so one way to do that is with floss. Another way to do that is, probably trying to use water picks for those that, you know, needs an extra supplement. So I definitely recommend water picks. I definitely recommend floss. I definitely recommend brushing consistently, seeing your provider. And I understand if it's a financial constraint, there are public health centers and community centers that take patients in, and they offer either complimentary treatment, or they can accommodate for the financial constraint. So there are resources, our low income clinics. And then there was also like dental missions. I went on a dental mission in Mexico where we offered, like I was saying, complimentary free dental care. So look for these things. And other things that I can think of is um, to be aware of some of these symptoms. So continue to research, look up, what are the symptoms of gingivitis? What are the symptoms of periodontal disease? Right. And just to be aware of these things so that you don't have a chronic issue. That's what I would recommend.
How can the ingredient fluoride benefit or harm one's teeth and gums?
Fluoride is a very controversial topic. Fluoride at a younger age can, if you have an excess amount, can cause what's called fluorosis. And fluorosis can manifest in teeth um, with kind of a mottled appearance. It's not a very attractive look, but past a certain age, there is no, with the water supply, if it's fluoridated, with toothbrushing that's fluoridated, with a fluoride varnish supplement, this actually has a lot of benefits because it helps to remineralize the tooth. So your tooth is made up of hydroxyapatite as one of the major components. And when you intake acidic beverages, or, with excessive brushing, or, if you develop, for example, an incipient caries, right? So a cavity that is not actually a cavity. It's actually when you have caries that can potentially lead up to a cavity, but in an incipient case, it can actually reverse itself. So once a cavity is made, then it cannot reverse itself. But the cavity, it takes time to develop. But with, flossing in between your teeth, if you have an incipient caries in that area, um, you know, you can also supplement this remineralization process by intake of fluoride. And this happens through drinking water. This happens through a fluoride varnish that you can have your hygienist apply or your dentist apply during your cleanings. So I would highly recommend those who are hesitant about fluoride to do more research about it. There's a lot more benefits than there are cons. And like I was saying, the biggest thing that I can think of in terms of fluoride supplementation is when you're at a very young age, your teeth have not developed completely, and this can potentially cause what's called fluorosis. I would also look up fluorosis, look up pictures of what fluorosis looks like, and it's just a mottled appearance on the teeth. But in terms of the actual benefits, like I said, it's actually a very good thing, and the fluoride actually helps to replace those lost ions when the teeth are now trying to remineralize. It's actually even stronger than the hydroxyapatite. So when it becomes remineralized, so I would really recommend that fluoride is applied for those that have all their permanent teeth, especially to have the topical fluoride varnish applied onto their teeth.
What are some harmful factors that can affect our gums when bleaching and whitening our teeth?
It depends. It depends on how much, right? And it depends on the components of the bleaching. So bleaching can cause um, sensitivity, and sometimes the bleach itself can actually like dry out the tooth, especially when you put an ultraviolet light on it. And that's what's causing the sensitivity, because now you have the dentinal tubules opening up, and dehydration of the tooth. And patients will always, not always, but some patients will mention that their tooth is hurting, and that they cannot eat, and they just have a high degree of sensitivity. So I would recommend that if you are going to be bleaching your teeth and you do develop these types of sensitivity patterns, you can use toothpaste such as Sensodyne that is used specifically for people that have sensitivity. Um, and that's probably one of the biggest things is sensitivity. But it can also, yes, depending on the components of whatever you're using to whiten your teeth, it can potentially cause very small, I mean, minimal, uh, um, uh, basically erosion of the enamel because of the components and um, how strong it is. But that's one of those things where it's if you do it consistently for a very long time, all the time. And I bleach my teeth every once in a while, so I can't be hypocritical and say that I don't do it. I definitely bleach my teeth. But I don't do it like every day, or every week. It's one of those things where I do it every so often, every 6 months, every 3 to 6 months, even, because I like to keep it where I like it, in terms of the shade. But yeah, those are just some things to consider. You will probably have some sensitivity, but the sensitivity usually doesn't take more than a couple days.
With the pandemic today, mm, with the pandemic today, many people prefer not to leave their homes. Are there any additional recommendations that the public should know regarding maintaining proper care?
So I would recommend, kind of like what I was saying before, is to pay attention and to continue your oral hygiene regimen at home. For those of you who have seen your dentist in the in the in the past, or have had a recent cleaning and they've given you some OHI, oral hygiene instruction, keep keep with it. You know, and for those that cannot afford, or are hesitant to leave their homes and go to see a healthcare provider such as a dentist or a hygienist, um, I would recommend that maybe you watch some videos to help guide you in proper brushing technique, to help guide you in proper flossing technique, um, to make sure that you're on top of it for at home care. Use a fluoridated toothpaste. It'll help to remineralize. Drink lots of water so that you can help to stabilize your pH. Um, like I was saying before, in terms of meals, space your meals out. Don't snack throughout the day. Separate your meals. Make sure to brush twice a day minimum. Flossing. Give time to eat um, after you brush. So don't eat after you brush immediately. Give time before you start eating, so that the actual fluoride that's in that toothpaste can help. That time can allow for that fluoride to actually be absorbed into your teeth. And so those are just some tips that I would recommend for those that are reluctant to go see a provider during this pandemic.
Thank you for watching our interview today with Jason Faghih, who is a upcoming graduate in April. He is wanting to pursue cosmetic dentistry and become an oral surgeon. If you guys have any questions or would like to know more about his journey in dentistry and cosmetic dentistry in the future, you guys can find him on social media at Instagram at dr.jasonfahig. If you guys have any questions for us, you can find us on our Instagram as well at Health Needs RX. And I hope you guys have a great day and thank you for watching.